let Erin introduce herself. I'm of course the social worker for the lung program, and I work with a whole bunch of other wonderful social workers here under the leadership of our supervisor, Krista Poole. All right. And Erin Cook is our physician assistant, and she is on the line now.
Hi, everyone. My name's Erin Cook. I'm a physician assistant. I've been working here at TOSIG for about 12 years. I see patients, I see lung cancer patients as well as GI cancer patients. I primarily see the lung patients though, and I'm happy to participate in this presentation with Shelly today. So thank you and welcome everyone.
So as I mentioned, our presentation is titled Mindfulness and Wellness After Cancer Treatment. And wellness is sort of self-explanatory. We all want to be well and as well as we can be in any state we're in. The mindfulness piece comes in with some practices that are pretty universal to our lives. And John Kabat-Zinn coined the term and the trainings. But the quote that I really like to start with is that awareness that arises through paying attention on purpose in the present moment, non-judgmentally, is a mindfulness practice. And to remember that this is a practice, it is not an end goal. It's something we practice every moment of every day. And it can help us. And Erin will begin sharing her section.
Thank you, Shelly. So today, Shelly and I are going to be talking about some of the physical, mental, and emotional effects of the cancer diagnosis as well as the cancer treatment that you've received. So just to give you an idea of what I do, I see patients throughout their treatment. I basically see them before treatment to make sure that they're doing well enough to receive treatment, make any changes that may be needed to their treatment regimen, and primarily I also help to focus on any like side effects that the patients may be experiencing and make those a little bit better for them throughout treatment. So one of the most important things that I like to emphasize to patients is that each one of your journeys is unique. Even though you may be talking to some patients who have maybe the same diagnosis and maybe going through the same type of treatment, how you experience things is not going to be exactly like how they experience things. And so I like for patients to just keep in mind that you should really take your time, be easy on yourself, and set realistic expectations, especially in terms of your recovery journey. Okay, next slide, please. So some patients may experience persistent symptoms or side effects even once their cancer treatment is complete. Some of the most common side effects that I see patients experience at the end include fatigue, just feeling like you don't have the energy to do maybe what you used to or what you would like to do in a day. Some patients experience taste changes, which can be due to a lot of times the treatments that we're giving you. It could be chemotherapy related. It could also be related to some radiation treatments. So the reasons may vary, but a lot of patients do experience some taste changes, which, I think it's important to keep in mind if any of you have experienced this, that most of us enjoy eating. And when that changes, it takes away the joy that we have from, a simple meal. So it can be a big deal and, understandably so. Some patients may experience hair loss related to chemotherapies and or radiation treatments. Sometimes this is a big deal for patients. Each person, like I said, is individual in terms of how they react or respond to this. For some, it's not that big of a deal. For others, it is. We're hopeful that once the treatments are completed that, your hair does eventually grow back. It's not always the same texture. It's not always the same thickness that it was, but we do hope that this improves after your treatment is complete. Some patients may also experience persistent neuropathies or numbness or tingling in their hands or feet. We do hope that as time goes on from the completion of treatment that this improves. Sometimes it does, sometimes it does not. So it can be a big deal when it comes to, day-to-day activities, and, kind of getting back to a normal routine, but that is something that patients may experience. And also pain. So you may have pain, cancer-related pain. You may have new pain related to the treatment that you're receiving. So these things could, persist for weeks or months, even after the completion of treatment. And this isn't inclusive of all, symptoms or side effects, but these are a few of the main ones that we see. Patients may also experience late and or long-term effects of the treatment. Those would include things such as fatigue, sometimes difficulty or pain with swallowing. We see this commonly with patients who receive radiation to, the head, neck, and chest area. Neuropathy can be, like we talked about, a long-term side effect of some of the treatments, chemotherapies that we use. Hearing loss and also kidney problems. So some of the chemotherapies can cause some damage to some of the nerves that may change your hearing. You may have a loss of hearing. You may have some ringing in the ears. So that's not uncommon. And then sometimes some of the chemotherapies can also affect the kidney function. So we have to watch that along the way. That's usually something that we, can closely monitor and make changes along the way, so we don't have, the long-term, effects of that, but it is a possibility. Some changes in bowel habits, including diarrhea and constipation, can be seen throughout and then following treatment, depending on the type of treatment that you received. Maybe if you had radiation, where the treatment, if you had like any radiation treatments, depending on where that was, it may cause some changes in bowel habits. So these are also things that you may have to deal with for weeks to months after the completion of treatment. And now that we are using immunotherapies, we also have to watch for the immunotherapy related side effects, which include an inflammatory response, which can really happen in any part of the body. So sometimes we get these inflammatory responses. A lot of times related to our immunotherapy treatments, and that could take weeks to months for things to calm down and for you to kind of get back to normal. Next slide, please. So in general, I like to tell patients once they've completed treatment that it's going to take at least 6 months to a year for you to truly heal from the effects of all the treatment and kind of get back to what you would consider your baseline. So for some patients, it may be shorter. For some patients, it may be longer. So be easy on yourself and give yourself time. And take things step by step. Like if your goal is to increase your activity each day, just do it gradually. Maybe try to increase it by 5 minutes a day or 10 minutes a day, whatever it may be. If you could kind of keep a little journal of things, you could at least see that you're improving and getting to that goal. And don't be hard on yourself if you're not getting there fast enough. As you complete your treatment and kind of get back to a normal routine, we do want you to keep in touch with your primary oncology team. We want you to talk with them about, what their recommendations would be for your nutrition, moving forward, how they feel about, your alcohol use. Most providers would tell you to limit your alcohol use. Depending on the type of cancer that you had and your treatments, they may want you to cut it out altogether. So that's something to discuss with them. Like I said, we want you to maintain some physical activity. Typically, we say, 20 to 30 minutes most days of the week. Physical activity is very important. It helps with a lot of different things. It can help improve your energy. It typically helps with your sleep, and it can help improve your mood. So a little bit of physical activity is good for you, and we would like for you to gradually increase to we have there 20 to 30 minutes most days. We want you to be cautious when you're out in the sun. Use your sunscreens. Um, almost all providers will tell you, no tobacco products. If you are using any sort of tobacco product, let your oncology team know, and we can definitely provide you with some resources or help you at least, start that journey of tobacco cessation. And also, watching your weight and kind of, keeping an eye on, your nutrition, and keeping your weight to an ideal range of where your oncology team would like for you to be. Next slide, please. So communication is going to be your key. I always tell patients, if there's something that's persistent, that's, going on for weeks to months, or things are worsening, we want to know about it. Okay. So let us know. Then we can kind of evaluate and see, do we want you to be seen? Do we want to maybe move up, some scans that you may have in the future? But do talk to us about anything that you're concerned about in terms of your symptoms. In additional to physical symptoms, we also want to know, emotionally how you're doing. If you're really struggling with, depression, or just kind of not feeling like yourself, memory issues, those sorts of things, let us know. We have additional resources here in Taussig, and we can connect you and hopefully make some of those a little bit easier for you. If you have any new symptoms that you are worried may be related to your cancer, reach out to your oncology team, let them know. They can evaluate, like I said, and see if you need to come in any earlier. But do let us know if something is concerning. And as you kind of transition back to like a normal routine, we do want to make sure that you get back in touch or back in the loop with your primary care provider. You're going to want to continue to see them like you have in the past, at least, once or twice a year, letting them know of any new symptoms or health concerns that you're experiencing that you don't think are related to your cancer. And also to keep up with like general health care for a man or woman of your age, routine cancer screening, regular immunizations, those sorts of things. So it's important for you to touch base again with your primary care provider and be seen by them regularly. Okay, next slide. So I've kind of gone through most of the physical effects of your cancer and the cancer treatment, and Shelly's going to take over and go through some of the mental.
Thank you, Erin. And by no means are we trying to suggest that our physical and mental and emotional effects are separate. It's just an easy way to present. So all of these things overlap one another, as you probably already know. We are a whole person, and an experience of cancer affects all of the realms of our person. So physical aspects were covered first. And as Erin mentioned, the mental and emotional effects are also something to discuss with your primary care and your oncology team. And some of those effects relate to concentration and memory and can be quite distressful. Keeping in mind what we said in the beginning, that mindfulness piece of paying attention in the present moment without judgment of yourself, and keeping in mind that a lot of these effects are temporary. And then finding focus on what you can control and your concentration ability in the present moment. So if you used to read a lot, and for instance, your concentration isn't allowing you to read more than a short story or an essay in the newspaper or something online, do that, start small and practice and keep in touch with us. And remember that stress, even a transition away from cancer treatment, which feels like a really positive transition, even good stress can impact our memory. So if we're going through a lot of transition, feeling additional stress, Our memory is going to have some limitations it didn't when we were relaxed. And then negative thoughts. Something like every change feels like it could be a sign of a new cancer or a progression. Just keep in mind that sometimes a bruise is simply a bruise, or a bump is simply a mosquito bite. But keep in touch again. Make sure you're touching base with us when you feel like something's not comfortable. And some of the questions you may have had going through your own mind: when will I feel normal? When will my health return? Or a statement like, I'm no help to anyone like this. I suggest, and so does research, suggests that a shift of perspective towards what we can control in the present moment can be a huge help and really impact our wellness and our ability to lessen our stress. For instance, maybe you're helping someone else because you're allowing them to engage in your care. And we all know that when we're giving to someone else, we feel really good. And allowing someone else who loves us to feel that is helping them in a particular way. Just keeping those things in mind can be really beneficial. So we've said some of these things already: practicing patience, also taking breaks, knowing that our attention span online isn't going to be at an hour or an hour and a half. So after 20 minutes, step away, take a walk, take some breaths of fresh air. Allow space for mistakes and report issues that are a barrier to your normal functioning. Journaling is a recommendation for those of us who feel like we need to purge some negativity. Get it on paper, record it, do something that helps you get some things away from your mind. Also, identify things that are in your control. Maybe you can't control negative thoughts like you want to, but perhaps putting them on paper feels like an exercise of control. Add skills to your coping with the help of your oncology team. Keeping an appointment calendar can help you with memory. List making can also help. So you make that grocery list or whatever kind of list, and as you check things off, just the feeling of accomplishment on things that can be completed in a short period of time. Laundry, done. Dishes, done. Writing that novel, in process. And that brings me to dream making. So some of us save our dreams for our bucket list. Mindfulness would say, dream now. Fulfill your dreams in the present moment. There is nothing like the present for those dreams to come true. And the dream aspect may shift. They may change. And that can be an exciting thing, something that we recreate for ourselves every day. And then also discuss any persistent memory concerns with your doctors, because we care. Feel your way. Erin mentioned emotional landscape, which our emotions are really ripe for change with any new day, any new transition. Consider what has helped you cope and how you feel. Remember that even when you use your coping skills, strong or disruptive feelings can indicate a need for help, specifically with two things: anxiety and depression. So anxiety, if you notice that nervous, racing thoughts interrupt your sleep, or that your anxiety feels worse, even though your body's healing and you're feeling better physically, or you have difficulty feeling calm when and where you used to feel calm. I never had trouble falling asleep, and now I do. That is probably an anxiety issue. And sometimes just identifying it helps it to go away. And sometimes it doesn't, and that's when we want to know about it. For depression, it's the most common and reliable thing for someone to just be asked, do you feel depressed? And if the answer is yes, then you probably do. Disinterest in things you used to like or love, bothersome changes in sleep or eating habits, weight changes that negatively impact wellness, or feelings of hopelessness. Those signs, if you're feeling 3 of them, it's really important to tell someone, like your doctor or a social worker or a family member. And if you're feeling 1 or 2, Talk to your friends and family and see what they think, if you're comfortable doing that. If not, come to us and we'll help you out. Recommendations are to reach out to family and friends, engage in things you like to do in smaller increments. So if you used to take long walks or watch full-length movies, just reduce the time down and do it more frequently. Attend to your personal hygiene, makes us feel better. Warm showers also induce calm. Using special aromatherapy sometimes helps us. Lavender is a great relaxer. Peppermint's a great pick-me-up. Stretch and breathe, even if exercise feels like too much. So if you're sitting here watching the Zoom and you're feeling a little sleepy, just take a nice stretch and take a nice big breath. Plan a special treat for a dessert. It's always good to treat ourselves. And your social worker or your prescribing physician can determine if you need a referral or a follow-up visit could help you. Call us, we are here for you, and we are going to provide phone numbers. We've discussed mental and emotional aspects of our whole person, and that doesn't necessarily impact our spiritual being, but it can. It can also bring our attention to our spirituality if we have sort of not paid attention to it for a while. Personal loss can impact our body, mind, and spirit. Acknowledging any loss you have had from a cancer journey can help you find your footing again. And those losses aren't isolated. You know, we've all gone through a time period of losing social connection through COVID. And I just give you a simple example of a timeline here. If you ever wanted to make your own and start with your cancer journey or before, a lot of times as a social worker, we're talking about loss as a whole. So all of the things that may have accumulated in your life and how those have impacted how you respond to your cancer journey and how you respond moving forward. Finding or revisiting deep connections can help us cope with those changes. And that spirituality piece is often part of our personal history, and it could be a present need that we have to call forth and embrace again. Meaningful moments and days can lead to deeper relationships with your work, with friends and family, and most importantly, with yourself. So we've talked about our physical, mental, emotional, and spiritual beings, which isn't the only, that's not a total of what makes us up, but that's a lot of who we are. And the recommendations here is to make a personal loss timeline, as we just mentioned. Take stock of friends and family who are present in your life right now. Make plans with people who care about you. Consider activity and solitude to reflect and rejuvenate. Music, meditation, reading, a walk in nature. And lastly, consider spiritual practices and resources for support and growth. And Erin and I have also compiled a list of resources. And I'll go to that page after I thank you for paying attention to what we had to share and reminding us to pay attention on purpose in the present moment without judgment. So thank you for your open attention this morning. Here are our references. We'll send these out to you. Most of them come from resources we use every day and share every day, so you may already be aware of them, but we'll reshare them for you. And now I'm going to stop sharing my screen so that we can hear from you.